Hairline design, it's really important. We do not want to make people look weird. It's so important when you do hair transplants. So a few important tips. I'll give you my top 3 on how to make a hairline look natural if you're looking for a hair transplant. Number 1, how do I make my hair transplant look natural or does it look like I had a hair transplant? Well, important landmarks we look for is we have the patients lift their brows up, and we do not want to put any hair into where the eye or the forehead muscles are lifting up. If your hair transplant moves when you're making expressions, it just looks like you had a hair transplant done. We can also look at old photos to see how low the hair went from the hairline. We typically just want to go right to where there's still some natural 1 or 2 hairs that are there. We just don't want to go too low. So that's a really important way about a natural hairline restoration. Number 2, you never want to come straight across from the widow's peak down toward the sideburn area because it's a giveaway that you've had a hair transplant. A lot of places across the world do that technique and it just looks a little overdone. The important thing about a hair transplant is that you want it to look very natural and you want it to actually fortify what you already have there, maybe come slightly in front of there, but you do not want to go extreme. Now, my patients who have lost a lot of hair, we also want to do an age-appropriate hairline. You don't want a 50-year-old patient having a 20-year-old's hairline. That just looks a little bit odd. Number 3 most important thing is to have the patient verify the marks before the procedure. And so we'll actually draw out your hairline and you'll see it in real time. And it's so important to have patients comfortable with the way they look. You can always go add more hair back later if you want to. Keeping in mind also that it takes 6 to 18 months. It really depends on how quickly the hair grows. So typically the hair goes into a dormant phase for about 4 months after the procedure. And then you can go back and reevaluate at 6 months, at 12 months, and 18 months. And many of our patients travel in for this procedure. So we do a lot of virtual consultations and follow-ups over video. And so it's really important for them to send us good photos. And most of the pictures I get from patients are just happy photos that their hair is growing in. But again, key thing to natural hairline, make sure it's age appropriate. You do not go too low. Number 2, no weird angles or hard angles from the widow's peak to the sideburn. And number 3, just confirm with the patients exactly what they want.